Applying for treatment at the Maastricht Heart and Vascular Centre involves several steps. There is an initial assessment, the request for treatment, a preoperative screening at your local hospital, deciding to go ahead with the treatment, preoperative screening at Maastricht UMC, admission to the hospital and the operation, and finally, discharge and aftercare. To make everything as simple as possible, the Maastricht Heart and Vascular Centre works with case managers, academically trained healthcare professionals serving as a fixed point of contact for all your questions and requests, from your application right through to aftercare following treatment. We start with the initial assessment, which is where your application for treatment at the Maastricht Heart and Vascular Centre begins. In addition to your personal details, we will also need your medical information in order to process your application. Your referring doctor will send us the information either in an encrypted email or by post. The information will then be used to discuss your case during the weekly multidisciplinary aorta meeting, where your official diagnosis and treatment plan will be drawn up. If you then decide on treatment at the Heart and Vascular Centre, the International Patient Office will send you an estimate for the treatment costs, along with the documentation that you will both need to submit a claim to your health insurer or the National Health Board. The next step is a preoperative screening at the local hospital where you are currently being treated. This means that your case manager will request some additional tests via your referring doctor. The vascular surgeon will use the results of these tests to determine whether the treatment risks are acceptable. If you officially decide to continue with treatment after the preoperative screening, you will then inform your case manager. To confirm your application, you will need to either transfer the deposit amount or send your insurer's guarantee statement to the International Patient Office. Once either the payment or the statement has been received, your case manager will schedule the additional screening and your treatment. If desired, our hospitality officer at the International Patient Office can arrange travel, accommodation, a visa, or interpreting services for you and your companion. Simply tell your case manager what you would like. 3 working days before your operation, several preoperative outpatient tests will be carried out at the Heart and Vascular Centre. You will not be admitted to the hospital for these tests. Instead, you will stay at the accommodation of your choice and at your own expense, which you can either book yourself or have us book for you. The day before your operation, you will be admitted to the Heart and Vascular Centre. During your hospital stay, care will be transferred from your case manager to the hospital's medical and nursing team. The vascular surgeon performing the operation will visit you one more time, when you will be able to ask any questions you may have or clarify anything you are not sure about. On the day of the operation, the nursing team will take you to the operation complex and give you all the information you require. The operation will be performed by the multidisciplinary team led by the vascular surgeon and will take 4 to 8 hours to complete, depending on the complexity of the chosen treatment. Afterwards, you will be taken to the intensive care unit or ICU. The nursing and medical teams at the ICU will provide your attendants with information for the first few days after your operation. Once your condition is sufficiently stable, you will be returned to the hospital ward. Your medical and nursing care in the hospital ward will be aimed at rehabilitation and reactivation. 2 to 3 days before you are scheduled for discharge, it will be clear whether you have sufficiently recovered to travel home safely. If desired, our hospitality officer at the International Patient Office can arrange return travel. This will be coordinated by your case manager. When you are discharged, your medical and nursing team will issue you with a treatment report. It will also be sent to your referring doctor, and agreements are made with him or her regarding the aftercare and checkups to take place at your local hospital. This includes an assessment of the post-operative CT scans by your own doctor. Any abnormalities will be discussed by the aorta team at the Heart and Vascular Centre. 2 weeks following your discharge, the international office will draw up your final account. This account may differ from your original quote, which will have been based on an estimate of the length of your stay in intensive care. This video was a brief overview of the steps involved in your treatment. For more information on aspects such as the tests, assistance from your case manager, or other services provided by the International Patient Office, please see our website or our brochure. We hope to welcome you soon.